you very much. You can start at your time.
No, we'll be starting at 5:30 sharp.
Okay, no problem. So I'll mute a little bit and then stay with you.
No problem. 5 minutes, 5 to 10 minutes we'll take for the initial thing and we'll hand it over to you.
No problem. No problem. Thank you very much and all the best.
Thank you. Thank you.
Thank you. Thank you.
I raise up my voice, not so I can shout, but so that those without a voice can be heard. Let's begin with the words of Malala Yousafzai, honorable dignitaries and fellow members of the IEEE fraternity. A very good evening to one and all. Welcome to the most awaited event of Women in Engineering Affinity Group IEEE Kerala Section, WiE 2020. WiE Summit 2020 is a virtual summit with a few insightful sessions and a cultural fiesta. Without further ado, to welcome you all on this glorious occasion, it is my honor to invite one of the pillars of support of IEEE Kerala Section, Ms. Sunita PV, Treasurer, IEEE Kerala Section, to give the welcome address.
Thank you. A very good evening to one and all. Am I audible?
Yes, you're audible, Sunita.
Okay. So a very good evening to one and all. And as you know, today we have gathered here for the inaugural session of the first program of WiE Summit 2020. And Kerala Women in Engineering AG has always been an active and vibrant group with passionate volunteers, both student volunteers and professional volunteers, and with a strength of 800 plus and 71 active student branch affinity groups. And this large international professional organization is dedicated to promote women engineers and scientists and for empowering the girl students as well as professionals. And we are conducting many programs all based on STEM. And our Women in Engineering volunteers always works as a team. So we could back many accolades. Recently, in last year, we have backed 2019 Women in Engineering Affinity Group of the Year Award and R10 Outstanding Women in Engineering Chapter of the Year Award. Now today we have organized this Women in Engineering Kerala Summit in 2014 and 2015 also under 3 heads: Women in Computing, Women in Leadership, and Women in Power. And this year also we have scheduled 3 programs. Today we have 2 special speakers for the program to speak about 2 different most relevant topics. Dr. H. Krishnamurthy, who is the consultant urologist at Lord San Lakshmi Hospital, Cochin, and Mrs. Rakhi Vijayanagar. And Dr. Krishnamurthy is going to speak about common urological problems in women, precautions and preventions. I extend a warm welcome to you, sir, to this function, and thanks for accepting our invitation and joining with us.
Thank you very much. Thank you.
Thank you, sir. Then our second speaker is Mrs. Rakhi. Her topic is Piece of PIE, the game reveal. And I extend a warm welcome you to ma'am and thanks for joining with us. Thank you, ma'am. And with proud and love, I welcome our most vibrant and passionate Women in Engineering volunteer, who is the present chair of IEEE Kerala Section, Mrs. Sharada Jayakrishnan. Welcome, dear Sharada.
Thank you, Sunita.
Now I welcome the Women in Engineering Chair of IEEE Kerala Section, Dr. Mini Ullanet, who is the backbone of Women in Engineering Affinity Group of Kerala. Then Dr. Bijana, the Chair of Joint Chapter. Then Mr. Nandan, Student Activity Chair, Mr. Shabira, and all other EXICOM members of Kerala Section, and all participants, student volunteers, YP volunteers, and all other professional volunteers. Once again, welcome you all to this function. Thank you.
Thank you so much, ma'am, for your warm welcome. Here we present a small token of gratitude from our part. Thank you, ma'am. I hope it's visible.
Thank you. It's nice one. Thank you.
I feel privileged to invite the chair of IEEE Kerala Section, Ms. Sharada Jayakrishnan, to deliver the inaugural address. Ma'am, handing over the platform to you.
Thank you, Amira. A very good evening to all the participants to today's session. Dr. Krishnamurthy, Mrs. Rakhi, my dear friends Sunita, Bijuna, Mini, and Nandan, and others who are part of the Exicom and also vibrant members of the Kerala section. It's indeed a pleasure to join today evening for the WiE Summit 2020. As mentioned, I think it's close to 6 years now that we have been conducting the summit almost continuously. And being the pandemic, the situation has also gone to a virtual mode where all of us have been so accustomed to the virtual scenario, having webinars, having panel discussions, and whatnot. So it is indeed a great idea by Mini and the team. In fact, when I initially heard about the summit, I was wondering how you can really attract participants in such a scenario where every other day you have a webinar. But then I think the team did a wonderful job in identifying what is actually required for the current women and lady students, not excluding the men and of course the boys, but then specifically for them, what is relevant today as we are approaching Christmas time, as we are approaching festive seasons, thinking about what happened in 2020, what is more relevant to be presented as topics. And you just look at the sequence. We start with our health as such. Our then post that you have session on mental health, which is very very important as on today. Then you move on to financial health. What better than that? I see the first three sessions, two today and one tomorrow, and then you move on to the colloquium by the students, and of course with celebrations we end on the last day. So it is a great idea, the whole team, the WiE team. I really am very proud to be part of that, and also it's indeed wonderful that you have come up with such a idea or such a subject line to have the complete healing for a person while we end 2020 and look ahead for what is best for 2021, considering also the situations, but also what are the opportunities that are available. Indeed, today I was just sharing a poster to Mini, which was basically a poster by Tata, where they have actually looked at recruiting only girl engineers for a manufacturing concern, which they are planning to set up in Karnataka. So times are really changing, and we need to be completely agile. Our body health, our mental health, our financial health, we have to be completely ready. So I'm very glad to declare that the event is inaugurated, the wonderful summit, and I look ahead to participating the whole time. And also, I'm sure the participants are going to gain a lot from this. So once again, congratulations to the whole team behind this, the professionals and also the students who have come behind to see. And thank you so much, the speakers, for finding time to share your knowledge and wisdom with us. Thank you once again. And Amira, over to you.
Thank you, ma'am, for your enlightening words. You are the central nervous system of our section. Without you, it's impossible to think of such an event. Thank you so much, ma'am.
Thank you, Amira.
Next, next we had Mr. Nandanes chaired student activities for felicitation as per schedule, but due to some medical emergencies, he couldn't join us. He sent all his support and love for the event. Thank you so much for motivation and support, sir. I would like to extend my invitation to Dr. Bijuna Kunju, Chair, IE, IA, and PL Chapter IEEE Kerala Section, to introduce our keynote speaker of the day.
Good evening, everyone. It's great to be part of WIE event, and it is my honor to give the details of our key speaker today, Dr. H. Krishnamurthy. He has done his master's in general surgery as well as in urology with MCH, and DIP&B in both general surgery and urology, as well as M&AMS. And from the qualification itself, it is quite clear to all of you that he is an expert in two fields, both in urology as well as in surgery. And he's now serving as the consultant urologist at Lourdes Hospital, Ernakulam, as well as the Lakshmi Hospital. He's a well-acclaimed urologist who has proved his academic expertise by publishing more than 100 articles in this field and had more than 300 presentations all over, and published 2 books and book chapters, and the list just goes on. It takes more time to describe his academic expertise. And in recognition of all these activities of his, he has been given the opportunity to serve as editor for medical journals of international importance in the field of urology, surgery, and even up to the oncology. He had already occupied coveted positions of president, secretary, and all positions in the Association of Urologists, both in Kerala and South India, as well as at the national level. He has won Best Young Scientist Award by the government of Kerala. He was a senior research fellow at ICMR and CSI.
We lost you, Vijna.
Vijna, maybe you can take off your camera so you'll have better bandwidth.
Yeah, one second. I'll just put. Can you hear me right now?
Yes, ma'am.
Yes.
Yeah. I don't know how much did you hear. Anyway, I was actually talking about the coveted positions that he had taken over in many associations of urologists in Kerala, in South India, as well as national level. He has won several awards, including Best Young Scientist Award by the government of Kerala. He was a senior research fellow at ICMR and CSIR, and currently he's a principal investigator for many projects in urology at Lourdes Hospital, Ernakulam. It is indeed my privilege to welcome Dr. H. Krishnamurthy for the talk today. Thank you, sir. Welcome.
Thank you very much, Dr. Bijuna. Let me go on to my presentation. Hope you can see the slide. Am I audible and my slides are seen to you?
Yes, sir.
Yes.
You can see it. Okay. Can I go ahead?
Please, sir.
Okay. Thank you very much, Dr. Bijuna, for the introduction. A little excessive for me. And I bring greetings from the medical fraternity to the lady engineers and aspiring engineers. I feel a little bit of in the odd man out situation because engineering is not my field, except that I have a peaceful acquaintance at home. The main problem is in engineering, 1 + 1 is always 2, but in medicine, 1 + 1 is never 2. So the engineers and the doctors do not get along well. But given an assignment to me, let me do justice to the best of my abilities. I heard that the engineers and the aspiring engineers would like to focus on health issues more than their academic activities, which is a welcome change. Probably the post-COVID era, because people understood that staying healthy would be the best way to tackle bacteria and other invaders of our health. So we move on. The common urological problems in women, the basics, the precautions and the preventions, what we can take. When we go to the urinary system, a little bit of anatomy will come into your picture. Now you can see, I'll play a video for you.
Human urinary system. The kidneys are a pair of bean-shaped organs that are part of the urinary system. The kidneys are dark red, slightly flattened, bean-shaped organs, each about 10 centimeters long, 5 centimeters wide, and 2 to 3 centimeters thick, with an average weight of 120 to 170 grams. The other components of this system are the ureters, urinary bladder, and the urethra. One of the main jobs of the kidney is to filter the waste out of the blood. The urinary system regulates the quantity and composition of fluids by removing metabolic wastes from our body. The system helps in retaining proper amounts of water, salts, and nutrients in the body.
So we learned that there are a pair of kidneys, the tubes which take the urine down to the urinary bladder and then outwards through the urethra, which is another tube. But the anatomy is slightly complex as you come into the pelvic region, that is the bottom part, especially in a female. We go into that anatomy because you have the uterus sitting just behind the urinary bladder, very closely associated with it. We'll play the video a little bit.
And the uterus. Here's the vagina, passing down through the pelvic diaphragm. This is the base of the bladder. The bladder was here.
So you can see that the lower part of the urinary bladder is very closely associated with the uterus and the upper part of the vagina. That exactly causes the problems in the bladder when you have a problem with your gynec organs. So the peculiarities of urinary system in the women include close association with the uterus and ovaries, very short urethra. Urethra means the tube that takes out urine from the bladder outwards. It's just 4 centimeters because in a male, it is about 25 centimeters. The close proximity to the vagina, which we also see in that video, and vagina is a reservoir of infections. Of course, the ladies are prone for, do have the menarche, the menopause, and the monthly cycles, where a lot of changes, physiological changes occur in the gynecological organs, and which when closely associated with the urinary bladder do create problems there also. Pregnancy and childbirth are unique to the ladies, causing problems not only in the gynec organs, but also in the urinary system. Of course, the social stigmata attached to the women also contribute to the peculiarities of urinary system, contributing to various illnesses. So, to be short, the urinary system in the women is disease prone when compared to the same in a male person. We will concentrate on 2 diseases which are very common in the ladies, which are to a certain extent preventable or can be, or the magnitude can be reduced by taking precautions. Number 1 is the urinary tract infection, which is called as the UTI. The lining of the urinary system is called as the urothelium, which when gets inflamed because of the bacterial invasion is termed as urinary tract infection. So basically the bacteria invade the lining, which is a sort of prevention, which is a sort of barrier to the body, leading to bacteriuria, which means bacteria coming in the urine and pus coming in the urine, and later on spreading on to the body through the blood. So urinary tract infection is basically a loss of the barrier in the urinary system. The prevalence is very common in females. It's rare in males. Girls, 8% of them do have urinary tract infection when they are in their childhood. The incidence goes on increasing, 30% between 20 and 40 years, and probably 70 to 80% as you grow old. But luckily in male also, luckily or unluckily, in males also, the incidence of urinary infection goes on as the age advances. So to be short, the females do have a large incidence of urinary tract infection. We talked a little bit about the bladder and the vaginal defenses. The flow of urine through the urinary tract keeps it safe. As you know, when the flow is large, the dirt will not accumulate. The acidic pH of the urine, with its high osmolarity, prevents the bacteria from colonizing. Urine contains lactoferrins, which scavenge iron away from the bacteria, preventing the bacteria from growing and colonizing. Various antibodies, neutrophils, interleukins, and various other mechanisms are there in the lining epithelium, preventing the bacteria from entering into the circulation. The fifth one is the most important, the lactobacillus flora in the vagina, which is protective to the females. The bladder itself has a lining of mucopolysaccharides, which prevents the bacteria from again entering into the bloodstream. Of course, the bottom line, the last but not the least, genetically determined factors. We do see that some of the ladies develop infection in spite of having all these in their urinary system because of certain unknown genetically determined factors. If their mother or sister had urinary infection, it's very well possible that the lady will also have urinary infection, which is unexplainable to a certain extent. The common risk factors of urinary infection, look at the red ones. Number one is pregnancy, sexual intercourse, estrogen deficiency. As you grow old, there is deficiency of estrogen, which we all know. There is loss of vaginal lactobacilli and loss of the normal barrier that prevents the bacteria from entering into the bloodstream. So old age, pregnancy are the two conditions wherein the urinary tract infection is common in the females. The word of UTI in pregnancy, the prevalence is about 10%. It starts from the first trimester, and the third trimester is the time when you have the maximum incidence of urinary infection. The enlarged uterus, the changes in the hormones, and the poor muscle tone of the urinary system all contribute to the increased risk. This can lead on to prematurity, prenatal mortality, and maternal anemia. So it is mandatory that the urine is screened right from the first trimester with routine cultures as and when the gynecologist advises. Common pathogens, not very important because you would have heard that E. coli or the Escherichia coli is a bacteria which contributes to the urinary infection in vast majority of cases. Of course, the organisms can vary from a lot of other group, starting from the fungi to the mycoplasma to the tuberculosis. So the most common is the E. coli. How does this E. coli enter into the circulation? Ascending route, we said the vagina is a reservoir, and through the urethra or the tube that takes out urine from the bladder, it gets into the bladder, and from there it goes up. Of course, the other mechanisms are spread from other organs through the blood or through the lymphatics, which contribute to a very minor sector in this, the causation of urinary infection. So ascending route from the vagina is the most common route of urinary infection. Now the symptoms, most of the females who have urinary infection have lower abdominal pain with frequent urination. Urgency means you have a tendency to pass urine, an urgent tendency to pass urine, but you are not able to pass urine. A burning sensation, reduced urine output, cloudy or blood-stained urine, and of course, fever when the urinary tract infection becomes one of higher degree. So the basic one would be the lower abdominal pain with frequency, urgency, and burning sensation. You have a lot of investigations which you can do, starting with your microscopy to identify whether the patient has infection, to culture and sensitivity to identify the organism and its sensitivity, and then you go on to identify the cause of urinary infection, the impact on urinary system, and what best could be done in that situation. The treatment would be to give appropriate antibiotics based on the culture report, adequate hydration, and rest to the urinary system. We go to the topic of preventions and precautions of urinary tract infection. Till now, we were telling that urinary tract infection is common in females because of their peculiarities in the urinary system, because of the proximity of the urinary system to the vagina and the gynec organs, and because of the changes in the hormonal milieu in a female when compared to a male. The tests which we do, the symptoms they produce, the tests we do to identify the infection, and the treatment. Now, in the prevention, previously, a lot of fuss was there on the underclothes and the use of faucet in females, especially school children, are scared of using the toilets, what they are provided in their institutions, because they are scared of the water which they use to wash their private parts. But the studies show that it is not significant anymore. The bottom line would be the cleanliness of the private parts is the most important in children. Fluid intake, it is best that you know how much of fluid to take and what to take. Plain water is the best, followed by your rice water, coconut water, or barley water. Somehow this barley water has been very common in the society. For anything and everything they consume barley, not knowing that it is actually a carbohydrate, produces a lot of acidity, it adds to the sugar and adds to the bloatedness of your tummy. Not needed at all. You just need to take plain water in a quantity of 1 to 1.5 liters, and you can increase to about 2 liters when you have symptoms of urinary tract infection. But the more important factor to see whether you are consuming adequate quantities of water would be to assess the urine output. Even if you take large quantities of water, if the urine output is not sufficient, you will have to jack up the consumption of water. So the urine output of about a liter or 1.5 liters per day would be the advocated amount of water which the patient should take. Timely urination. Timely urination prevents the colonization of bacteria and flushes out the bacteria. When the urinary system distends, we said there is a lining of mucopolysaccharide or proteins. When it distends, this lining gets disrupted. and the bacteria enter into the circulation. So when you have a timely urination, the bladder remains contracted, the urinary system remains contracted, the lining is maintained, and the bacteria gets flushed out. Now you have a peculiar syndrome called as, a situation called as lazy bladder syndrome, which we'll come to a little while later. It's very common these days, people who do not have the habit of urinating at timely intervals do develop a particular situation called as lazy bladder. The bladder in their later years fail to contract, the bladder fails to contract and push out urine in these females. We do see lots of them. Medication, these are all which you can try. There are various medications which are available to prevent urinary infection, to protect yourself. Number one is the group of medicines which prevent the colonization of bacteria. The foremost would be estrogen replacement therapy. What estrogen does is it reduces the vaginal pH. We said acidic pH is the best to prevent urinary infection. It prevents the bacterial colonization of the vagina. It gives a lot of lactobacilli. It permits the lactobacilli to multiply in the vagina. Lactobacilli is a commensal organism which we want in our body because it prevents the pathogenic or the devilish bacteria from growing in the vagina and then going into the urinary system. So overall, the urinary tract infection rate comes down by about a third. So estrogen replacement therapy. Now, mind you, oral estrogens are not useful. You need to apply vaginal estrogens, which are easily available in the market. You apply it once a day at bedtime. It does a lot of good for people who have recurrent urinary tract infection. Number two is the probiotic agents. The World Health Organization defines probiotic agents are living microorganisms that have a positive effect on the health and physiology of a person when taken in adequate quantities. And the most important and studied and popular probiotic agent is lactobacillus. You would see that most of the curds, most of the milk are all, it will be written lactobacillus enriched or probiotic enriched. That means they contain a lot of lactobacilli. The lactobacilli is a useful bacteria which prevents the interference with the pathogenic or the disease-causing bacteria, preventing them from adhering, growing, and colonizing in the vagina. So the lactobacilli outgrow the organisms which produce disease. There are various types of lactobacilli which are available for the premenopausal women. The Lactobacillus crispatus is the best, and oral capsules are good for postmenopausal women. But to be frank, capsules containing pure lactobacilli are not available as such now. You have enriched food materials which are available which contain lactobacilli. So consuming them for a long duration of time would be helpful for women who are prone to have recurrent urinary tract infection. Number three is vitamin C or the ascorbic acid. It's very popular these days because it is said to prevent or reduce the complications of COVID-19. Vitamin C, what it does is it again reduces the urinary pH. We said acidic pH is the best to prevent bacteria, reduces the incidence of UTA, but the quantity that is to be taken and the duration for which it has to be taken is not very clear. So probably you can take vitamin C 1 a day for about 3 months or 6 months. It takes care of a urinary infection. Number two is a category of medicines which prevent the adherence of bacteria. The foremost is the cranberries. Cranberries were popular elsewhere, now it has come into the market. contains an active ingredient called proanthocyanidine. This proanthocyanidine actually inhibits the adherence of the bacteria. So reduces the urinary tract infection to about a third. Dried fruits, powders, extracts, juice, etc. are all available, and most of the tablets contain 300 milligrams of cranberry extract. It's freely available in the market. It does good to a lot of ladies who get recurrent urinary tract infection. Number 2 is D-mannose. D-mannose again prevents the bacteria. Fimbria is actually a filamentous organ of the bacteria, which helps the bacteria to get attached to the urothelium or the lining. So it prevents the adherence of this fimbria to the urothelium and reduces the urinary infection. Forget about the dose. There are capsules available containing a combination of D-mannose and cranberry juice extract, freely available in the market, not scheduled, can be purchased and can be consumed without side effects for a long duration to reduce the urinary infection. The third group of drugs are called as phytotherapeutic agents. These are very popular elsewhere. Somehow the phytotherapeutic means plant products or the herbal medicines. We make a large hue and cry on the sale of Ayurvedic and herbal medicines in India. But the wiser men abroad, as well as in China, do use these herbal medicines to a great effect. Canafron N is something which is available abroad, not in India, which contain extracts of various spices like the lovage and the rosemary, contain large quantities of essential oils and flavonoids, and how they act is yet to be studied, but they are very useful for the prevention and even for the treatment of urinary infection in high-risk patients. So if this drug is available, probably one can try using it. Hibiscus subdarifa is a particular type of flower which is available in some of the places in India. Again is useful for the treatment and prevention of UTI. Luckily, the extract of this is also available as a capsule combined with cranberries and D-mannose. So you have a combination of all the three available as a capsule, giving protection to urinary system. Vaccines, a lot of hope on this, could be oral or intravaginal, wherein the heat-killed E. coli bacteria are extracted of their antigens and then either given as capsules or as intravaginal pessaries to stimulate the innate immunity. A lot of vaccines are in the last phase of trial, and hopefully some of them will be available in the market by about a year or two, which would help the ladies who are prone to have recurrent urinary tract infections. So let us hope for the best to have the vaccine in the near future. So we have summed up the causes of urinary infection, how they occur, what you can do to prevent urinary tract infections, what precautions you can take, what treatment you can take, and in the future, how vaccines are going to be helpful in the prevention of urinary infection. Now we go to the second condition. It is called as female urinary incontinence. Why we chose these two topics is that this particular condition is extremely common but extremely underreported. What happens is, we will go to a little bit of anatomy here. The bladder is often compared to a balloon, though in principle or physiologically both are different. What the bladder should do is that it should store urine at low pressures. That the second part is more important, which does not occur in a balloon. The balloon can store water, but the pressure also goes up. But in a bladder, the pressure should not go up. And it should expel urine at suitable intervals. The second part is again important. At suitable intervals, that means it should be under your control. So though bladder has been compared to a balloon, both can store, both have elastic properties. The balloon stores water at high pressures, and the water contained in a balloon will come out at its own suitable time. We can't have a control on it. So in short, the bladder will have continence. That means it can store urine not only when it gets filled up, but also at the time when it contracts to pass out urine. What happens is, when the bladder gets filled up with urine to the tune of nearly an ml per minute, the intravesical or the intra-bladder pressure is always kept static. This is a very, very important property of the bladder. The more the bladder distance, the pressure will remain the same. This property is called as compliance of the bladder. It's because of various properties in the lining, the musculature, the neurogenic mechanisms, as well as various other paraneurogenic mechanisms. So we just have to understand that the urine that is stored in the bladder, whatever be the volume, the pressure inside the bladder remains static. It is to the tune of somewhere around less than 10 centimeters of water. Now, at the same time, the passage through which urine comes out, that is the urethra, again, it should remain in a contracted state, because the urine that gets filled up in the bladder should not come out. So the pressure in that part of the bladder, that part of the muscle which surrounds this passage, should be high. So the pressure in the urethra is high, the pressure inside the bladder is low. And you have various other mechanisms in the urethra that also prevents the urine from leaking. So this continence is peculiar for the bladder to store urine in the bladder and keep the outlet or the passage closed. We call it as hammock effect. Hammock is our unyala that you would have seen. This people lie down there for entertainment. Now, there is a sheet of muscle in the pelvic floor on which all your organs, your bladder, your uterus, your intestines, all the intra-abdominal organs lie. So this is called as a hammock. This prevents, it should have its tone so that it prevents the organs from jutting out and the leakage of urine and other materials from the abdominal cavity outwards. So this hammock effect is one which prevents the leakage of urine, maintaining continence. During voiding, or during when the lady passes urine, the desire to pass urine starts when the bladder is half full, but then we can keep it suppressed until a suitable time and place is chosen. This is peculiar for the urinary system, the bladder, not for a balloon. And during voiding, what happens is the reverse. The pressure in the outlet or the passage through which urine comes out first reduces. The muscles relax there. The pelvic floor or the hammock relaxes. The bladder neck or the proximal part of the urethra becomes a funnel. And then at the end, the bladder contracts to push out the urine. This coordinated mechanism is extremely important to completely empty the urinary bladder. If this doesn't happen, this coordinated mechanism doesn't happen, what happens is when the bladder muscle contracts, the muscles in the urethra also contract, the pressure inside the bladder rises and the kidney gets damaged and the urine doesn't come out completely. Urinary tract infection develops. So the coordinated mechanism of the bladder and the muscles, the pelvic floor muscles and the urethra, the nerve system, all are important in maintaining continence and proper urination. So the continence is maintained by a delicate balance of various forces like the pressure in the bladder, the closing pressure in the urethra, the length of the urethra, the pelvic supports and the various muscles. This is extremely important, a very complex mechanism which when gets affected will lead to diseases. What can go wrong? The two places where it can go wrong are, number one is the urinary bladder itself, damages to the urinary bladder, and second is the damages to the urethra. This leads to urinary incontinence. Incontinence means there is a loss of urine causing social or hygienic problem. And see the incidence, it occurs in nearly 40% of elderly females, though the reported number of females having urinary infection coming to the hospital would be less than 5 or 6%. That means it is an underreported condition. They take it as part of their physiological process, not as a disease. Now, when there is a damage to the bladder, there is involuntary loss of urine. The urine doesn't get stored there. The bladder pressure increases. There is a sudden, strong desire to void, which we call as urge incontinence. It's mainly a neurological disease. But when the patient coughs or sneezes, or when there is a severe physical activity and the urine leaks, it is called as stress urinary incontinence or the SUA. And this is because of the problem in the outlet. And in females, stress urinary incontinence and mixed incontinence, having these two, contribute to the major sector of incontinence compared to the males. In the males, neurological problems are more. In the females, the outlet problems or urethral problems are more. So the stress incontinence is probably limited to the females. So we will focus on the stress urinary incontinence because we said the urge incontinence is mainly a disease of the neurological system and you can't do anything to prevent the urinary system. So the stress incontinence means there is an immediate loss of urine when there is a cough, laughing, exercise, sneezing or intercourse. So you just look at this video.
Stress urinary incontinence in women. Urine is produced in the kidneys and stored in the urinary bladder. Urination is the process of emptying the bladder through the urethra that connects the urinary bladder to the external urethral orifice. There are two sphincters, or valves, that keep the urethra closed to prevent leak. Internal urethral sphincter, located at the neck of the bladder, and external urethral sphincter, located right above the external urethral orifice and is supported by the pelvic floor muscles. When the bladder is full, stretch receptors in the wall of the bladder send a signal to the spinal cord and the brain. At times when it's not appropriate to urinate, the brain sends back an inhibitory signal to keep the sphincters closed and prevent voiding. When you wish to urinate, this inhibition is removed. The spinal cord instructs the muscle of the bladder, the detrusor muscle, to contract and the sphincters to open to let the urine out. In stress incontinence, small amounts of urine leaks when the person is sneezing, coughing, laughing, or having any activity that creates abdominal pressure on the bladder. This usually occurs because the pelvic floor muscles are weakened and can no longer support the sphincters. In women, this typically happens as a result of pregnancy, childbirth during which these muscles are overstretched. In most cases, this condition can be treated with exercises that strengthen pelvic floor muscles.
So that is stress incontinence and causes a lot of embarrassment, discomfort, fear, anxiety to the females, and they need to restrict their physical activity, and there is a chance of urinary infection. The risk factors are basically those which cause damage to the pelvic floor or the hammock, multiple vaginal deliveries, postmenopausal because of estrogen deficiency, smoking, and pelvic surgeries. The diagnosis is by seeing urine leak when the patient coughs and by doing an array of tests. The treatment would be to electrically stimulate the pelvic floor muscles, consuming drugs or having implants. And then when these fail, you go to surgery, and the last resort would be to use an artificial urinary sphincter. We go to the prevention or the precaution part of it. You would have heard about the Kegel's exercise, which is basically to strengthen the pelvic floor muscle as well as to strengthen the buttocks and thigh muscles. And there are a couple of videos which will tell you how to do a Kegel's exercise in females who have a tendency to have stress urinary incontinence or who started leaking urine a little bit, who had traumatic or a very bad obstetric history, or a prolapse of the abdominal organs. This would be of use to you. Now, the first video will tell you how to strengthen the sphincter muscles.
The pelvic floor is the base of the group of muscles referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back and from side to side. They support the bladder, bowel and uterus, and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around your vagina as if you are trying to stop the flow of urine. Lift them up inside. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice as you tighten and lift your pelvic floor muscles, they tighten and close around the anal passage, vagina, and urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
So this takes care of the pelvic floor muscle, whereas this exercise would help to improve the musculature, the muscle function of your buttocks and thighs. A small video for you.
Bridging. Starting position. Muscle contraction. End of exercise. Muscles involved. Breathing.
So the second exercise will give you adequate strength to the muscles of the buttocks and the thighs. Now, there are a few conditions which can manifest in women in their later life. One is the overactive bladder, which we call as Hinman syndrome. And the second is a lazy bladder syndrome, about which we talked a little while earlier. Overactive means the bladder pressure is more, underactive means the blood pressure is less. Both are due to faulty toilet training. You would have seen that some of the girls assume this particular posture, which we call as Vincent's courtesy, when they sit. They actually what the muscles get when they assume this Vincent's courtesy is that the pressure in the pelvic floor muscles and thigh muscles actually go up. So this prevents the urine from getting leaked. So it is an indirect way of preventing the leakage of urine, a particular posture assumed by the girls to prevent urination at a time when they sit and work or for some other reason sit for long hours of time. Later leads to an overactive bladder or a lazy bladder. So to sum up, the general precautions what we can take are proper toilet training, avoid constipation, personal hygiene, adequate hydration, timely micturition, exercise, and seeking early medical attention. So thank you very much for your patient listening. Wish you all a Merry Christmas. I wish the Ladies Summit, the Ladies Summit of the Engineers, the very best. Happy New Year too. And thank you and have a good day. Thank you.
Thank you so much, sir. Are there any queries for the speaker? Are there any doubts? You can directly send it to me. I'll not reveal the person who has sent.
Amira, can I just ask a question?
Yes, ma'am. Yes, ma'am. Sure.
Thank you, doctor, for the wonderful presentation. In fact, we never realized that 1 hour is over. I think you have taken us to a different level. Actually, it is not a question, but I feel that this is the very essential things which we need to tell our younger generation, both pre-menopause as well as post-menopause, and many things like including that faulty toilet training should be informed to our girls quite an early age. Maybe because of the ignorance, many times I feel, and the social stigma which has been attached to it, I think this is not being uh, openly discussed also. I'm extremely thankful to you, doctor.
Thank you very much. Thank you.
Wonderful. Any other questions? You can continue.
Anyone? Are there any queries for the speaker?
The woman engineer beside me says that the time is up.
In fact, we are thankful to that women engineer also.
Yeah.
Introduced you.
I think we can have a look at the women engineer by your side also in the video.
Yes, here comes our.
Hi. that closes our surprise, right?
Oh, it's a scary association. It's
Right,
a very scary association.
Great, Meenakshi. Thank you for so much for giving us the opportunity to listen to Dr. Krishnamurthy. Thank you very much, sir. We had a wonderful talk.
It's a pleasure.
Thank you very much. Thank you.
Thank you.
Thank you so much, sir, for your insightful session. Talking about urgency, leakage, pelvic floor disinfection, and other issues might be uncomfortable, but I personally think it's the first step towards self-care. So here is a small token of gratitude from our side. Hope you will like it, sir.
Thank you very much. Thank you very much.
Next, I would like to extend my invitation to Dr. Shabira TP, Vice Chair, Women in Engineering IEEE Malabar Subsection, to introduce our next keynote speaker of the day. Ma'am, handing over the platform to you.
Hello, am I audible?
Yes, ma'am,
Hello.
you're audible.
Okay. Good evening, one and all. I'm very happy to introduce the speaker of the next session, that is Rakhi Vijay Nair. She's a co-founder of Vajra Learning Solutions, an industrial psychologist, behavioral coach, design thinking practitioner, and a facilitator with 27 years of experience in organizational transformation, performance management, and building and engaging individuals and teams to produce better business results. She is also engaged with various educational institutions, colleges as an educator, as career mentor, and a career transitioner. And she has helped more than 1,000 students to get placed and choose their right career. She has delivered more than 2,500 sessions and touched the heart of over 2.5 lakhs participants. She is also a certified RAC coach from NLG, engaged in group coaching, competency mapping, TNA, content development, and tailor-made session, ranging from succession to leadership training, ensuring meaningful, impactful, and visible productivity aligned with organizational goals. She is also specialized as a mentor and facilitator for entrepreneurship skill development and have facilitated more than 50 projects to develop ideas to business plans, chief mentor for empowering women startups like Kudumbashree on entrepreneurship skill since 2017. She's a lead trainer empaneled with IEEE Kerala for Entrepreneurship Skill Development Program. Rakhi is also a certified NLP practitioner and uses several NLP tools to identify and harness empowering thoughts patterns in her participants. She's a motivational speaker and blogger. She also carries trainer certification from British Council Academy for training the trainers and many certifications as a facilitator. As part of her employment, she has held management positions in L&D, customer service, airline, and hospitality industry, guest faculty with Indian Maritime University and CUSAT for business communication, cultural anthropology, and organizational behavior, long-term engagement with 2 of the Fortune 500 companies with global experience in aviation, hospitality, and training. Communication scales behavior, keynote and motivational speaker at various seminars and conference key areas for performance, strategic thinking, communication, sales, behavior, train the trainer, leadership development, etc. She has worked with most dynamic leaders across the globe and in varied industries such as IT, airlines, and hospitality about 26 plus years. And she has facilitated more than 2,030 sessions, imparting training to more than 2.5 lakhs of people. And she has worked with many companies like Oracle and banks like Axis Bank, Indus Bank, South Indian Bank, etc. So I'm very happy to welcome you, ma'am, to this session. Rakhi, ma'am, over to you.
Thank you so much, Shabina, right? Okay, I'm very embarrassed actually, and at the same time, I remain humble. I think we should have actually, made it very brief. I feel very embarrassed actually to be, I don't know, like I need to shoulder this responsibility also. But anyway, thank you so much for that wonderful introduction. Okay, I welcome all of you, and it's a great delight to be a part of anything to do with women for me, okay, and women in engineering. And I really thank IEEE for inviting me to this particular session as a guest, as a speaker. With your permission, I would like to share my screen. Shall we commence? But I want to make it a little interactive. So are you all ready for that?
Yes, ma'am.
Yes. Okay, wonderful. So allow me to share my screen. So perhaps you all might have seen my topic. Okay, so I welcome all of you. My name is Rakhi Vijay Nair. I would like to call myself as an educator rather than anything. And this session is based on, or I would say, inspired from a book written by Harvey J. Coleman, okay, one of the best sellers even in Amazon also, Empowering Yourself. And it's also called as the organizational game revealed. I could really resonate with this particular concept, which I would love to introduce, and I'm very passionate about this particular topic. So, with your permission, let's start. So, I just wanted to ask you, this is just a small icebreaker, all right? So, you can always feel free to use your chat box, or else you can even unmute yourself as well. I hope that I'm audible and I'm visible also. Can you somebody confirm it through the chat box?
Yes, ma'am. You're audible and the screen is visible. Your video is visible.
Perfect. Thank you so much for your confirmation. And this is just a video. What I want you to do, see this video. There's no sound, okay? So don't worry about that. What's the message that you hear? So I just want you to think about it. So open the parachute of your brain. Wow, what a beautiful, uh, I would say, GI5. So what do you think, like, what is your reflection upon that? What's the message that you hear? Can you please put it on the chat? It's an engineering to your brain. I'm waiting. Wow, very good. Self-treatment or self-cleaning, very good. Okay, cleansing, okay. Clear away all the unnecessary things in your brain. Okay, I loved it. Okay, what else? I'll go for a few more answers. Let the wheel of the brain start rolling. Being at peace with yourself, very good. Okay, interesting. Open your eyes, see the world around you. Wow. So many perspective, right? Creating positivity. Very good. Okay. So thank you so much for all your answers. So I believe that you will definitely pay an attention to this particular small session with a new pair of eyes, with a new pair of ears, and a new heart. That is what I want you to do. Please do concentrate. This is my interpretation. Okay. Thank you so much for being a part of it. I just wanted to know we all are here. All right. Okay. Now, are you willing to explore a top secret which only 10% of the population know? Do you want to know about it? Only if I get a yes on the chat, I will declare it. I will reveal it. Yeah? All right. So there are so many yes. Yeah, definitely. Why not? All right. So do you want to be successful? In all walk of our life? Yeah, absolutely. We all want to be successful. So what do you think? What are the 5 skills? Okay, there are many skills that we require, but according to you, what are the 5 skills required to be a successful professional? What do you think? Okay, Leadership quality. Okay. What else? Smart work. Excellent. Optimistic. Positive attitude. Okay. Great. All right. Now, definitely, when we talk about soft skills, this is the secret, okay? What to be successful, we need 85 percentage of soft skills. This is what the survey says, the research says, and 15 percentage of the domain expertise. Okay, maybe for you it is debatable, but let me tell you, if you want to be a real performer in your organization or in entrepreneurship skills, definitely you're going to deal with people. So we might need to definitely look into developing our 85 percentage of our soft skills to be successful. All right. And another secret, which will be surprising for all of you, what we do in our life, 93 percentage of the time, energy, money, we invest on domain expertise. Do you all agree with me? How many of you agree with me? Can I hear some your comments? Yeah. Isn't it so? So we invest only 7% of the time, energy, money on developing, attending a leadership program. How many of you really invest money? We expect probably our organizations to sponsor ourselves, right? But we don't invest on ourselves to grow sometimes in our career. Yes, we do it for the technical skill, but we don't do it for the soft skills. I hope you liked that secret. Can I hear some comments on that? Good to know. Yeah, the secret. Yeah. Thank you so much for that. Okay, a few questions. I just wanted you to just answer this, okay? So the answer, you can put it in agree and or disagree, okay? That should be your answer. So you can say A or D is also fine. You don't have to really type everything. So you just have to type A and D. Are you get ready for the game? Yeah, all right. So be hardworking, you will be successful in your career. Do you agree or disagree? Agree. Okay. A, D. I'm getting a mix of answers. Okay. You, my dear friends, you don't have to put disagree itself. Just put A or D. That's enough. All right. Okay. Many people agree to that. Okay. So the next question, be a good performer, success will be yours. Be a good performer, success will be yours. I've got again a combination of A and D. All right, so let's move on. Be yourself, others will adjust with you. Okay, so here I'm getting a lot of D. Okay, interesting. I'm sure that everybody is thinking, you know, I could really make up. Now, this might be the last question right now. Promotion is based, you know, if you want to be promoted to the next level, which is tangible one, okay, tangible promotion, I mean, how many people depends on, okay, how many people know you? Oh my God, I think I really need to work on that. Okay. Okay, I have got some answers as well. All right. So I'm going to reveal the secret for all of you. What if I tell you, I'll take you back, okay? What if I tell you for this, okay, be hardworking, you will be successful in your life, is actually, it is disagree, okay? Not necessarily that you are hardworking will bring you success in your career. In fact, if the hard work is associated with bigger challenges, perhaps, okay, it could be one of the components. Now, be a good performer, success will be yours. Again, it is what Harvey Coleman says that no, okay, it is again disagree. You cannot be only a good performer, will not. It will give you the first entry ticket. If you're a good performer, it will provide you as an entry ticket to to fall on that particular level. Now be yourself, others will adjust with you. And I'm sure that with this COVID, we all have understood the importance of being agile, right? Agility, being adaptable, being resilient. We all have realized it very well. I think that is the reason I got so many answers which are right. Actually, if you be yourself, others will adjust with you. No, it doesn't work that way. That's again, Harvey Coleman says no to that. The last but not the least, as of now, promotion is based on how many people know you. This probably would be a paradigm shift for you. He say yes to that. Okay. So maybe you're confused now. Let me try my best to clarify certain things for you so that moving forward, you can really have an awareness of this particular concept, which I'm going to introduce you, will give you a lot of insights and you can reflect upon how you want to take your career, okay, ahead. Okay, so I hope that everybody is ready for that. So it is again, the topic is 3 keys to career success, growing your career, the PI model. Okay, so what PI stands for is presence, image, and exposure. So these are the 3 pieces of PI. It's not the other PI, okay? It's this one. It is performance, image, and exposure. So mainly, when you are performing, it is about your full utilization of your skills and your abilities. But there is one question which I'd like to put it across to you. We all might have heard about the competency, right? The competent or the being competent. So what I have figured out, not only with the students, okay, even amongst the corporate, when I did a session yesterday, they don't know exactly how to differentiate between skills and competencies. Maybe I'll just put a little effort to that, okay? See, definitely competency is about the combination of knowledge, skills, experience, and behaviors that distinguish performance. You are the best. Okay, there'll be many people competing for that, but why are you the best? So there is always a benchmark which is associated becoming a competent for that particular thing. And what are your contribution, okay, to the organization and opportunity to the development. Now, image is all about what other people talks about you. Okay, what is the image that you have created in your college? Okay, what others talk about you, your brand. Okay, if I ask you what are you known for in the college, okay, or in an organization also, what is that brand that people have given it to you? So it's all about your results, your reputation, the credibility, very important. Okay, and the whatever that you're best at, your style of everything, we will definitely discuss it in a little detail in another 1 minute, 1 or 2 minutes. And exposure is about, which is important as well, visibility to executive leadership, visibility to broad network, then crucible roles and sponsorship. Now, I have a small question to all of you. Okay. If I ask you, I'll give you 100, I'll ask you to rate these 3 in 100 percentage. Out of 100 percentage, what do you think? What is the weightage that performance carry to be, if you want to be successful in your career, how much percentage do performance carry, your performance weigh to? Can I get few answers to that? 75 percentage, 80 percentage. All right. Okay. Can I get a few more answers? I'm glad that people are thinking now. I hope that the brain is rolling. Okay. 45. Okay. Good. Interesting. All right. Okay, 80 percentage. Okay, how much you want to give to image and exposure? If you think performance is 75, 80, can we also rate it way with that way? Image and exposure. Definitely, certainly, all these three are important as per how we call men. Can we get that? What do you think? How much we should give to performance out of 100? How many percentage for performance, image, and exposure? If y'all can put it, P so many, I so much, E so much, I'll be really glad. P45, I30. Good guess. Okay. Urmila says 50, I for image. Interesting. Okay. So let's find out, because we have got time constraints, I believe. So if I tell you this is what Harvey Coleman tried to claim, are you surprised? How well you do your job has very little to do with how successful you are in your professional career. Or more precisely, if I have to say that, how well you do your prescribed work will account only for 10% of your overall success. That's what he mentions in his book. Okay, he asserts that the career success is based on a lot on your image and your exposure. So that let's just try to understand it little more better. So do you all agree with this by any chance? Or it'll be a great effort that I need to put on to make you understand that. Okay. So I'm sure that you are in a mind that don't tell us, okay, show us, right? I know this is what they're in your mind. Okay, let me show you. Okay, so the Harvard Business Review, especially for the HR, the human resources, okay, they have classified the people, whether it is a college, wherever it is, okay, they classify people into two categories. That is, they call it as the hippers and hippies. Okay. Now, what are they called? Hippers, that hippers means high performers, and the other group, hippies, are called the high potential, sorry, hippos actually. They are called the high potential people. So the statistic says the top 1% of the workforce in an organization accounts for 10% of the organizational output. Only 1% accounts for 10% of the organizational output. 66% of the organization report that they purposefully identify high potential employees. Now, what is the difference? Okay, let me just explain it to you in 2 minutes. High performers people, suppose for example, a person who is very good in sales, okay, he outperforms everyone, but the way he responds to other people, he is not very good as a team player. He's an individual player, but he is not a team player. He is a little rude with the management, okay, and he is not adaptable with other people. All right, that is a one set of people, or one person is like that. Now look at another person, a person B, who is okay, is achieving his target as a salesperson, but at the same time he has got a very good relationship with other people. Okay, that he maintains, he's a very good team player, he's very adaptable, he helps other people, he brings in a lot of ideas, he removes the roadblocks for people, he becomes a change maker. Now you tell me, you saw these two people, right? Now when there is a promotion comes in, who do you think is more eligible to be a leader, or who has got high chance of getting into the next level? Who do you think? High performer or high potential person? Is it the salesperson or the second person, as I claimed? Who do you think? Can I get some answers here? What do you think? Who do you, the salesperson? Okay. Okay, good. You mean the hippers will get promoted? Yeah. Is that what you think? The performers or the potential? Put it that way. Is it performers or potential? Performer is the person who performs good as in sale, but he is not a team, a team player, or the other way. Okay, the hippos, right? Okay, the high potential people. That's what we said. Like, there is a lot of deficiency in many of the organizations that if you really take, they say that they have a lot of high performers, but they don't have high potential people who can lead the organization to the next level. Don't you think that our nation is also having this kind of challenge right now? We don't have proper leaders. Okay, so what it says, it is estimated that only 10 to 15 percentage of the hippers are hippos. Okay, of the high performers are high potentials. So this is a beautiful, again, a claim by Harvard Business School. They say that the best players don't always make the best coaches. Thereby, the best employees may not make the strongest leaders. So when it comes to performance, it's all about the day-to-day work that you are tasked with. In this case, the quality of the result that you deliver, that everybody delivers very well. Everybody perform very well. Maybe in the college and school, you know that if you really work hard, if you perform very well, everybody will get that percentage of mark, right? Okay, or percentage, grade, or whatever it is, score. However, when it comes to organization, there's only one promotion that is waiting for, and about 20 people are competing for the same. Everybody performs well. And who will be eligible for that? So if you all do well, perform very well in job, you will get only a form of maybe, okay, a pay raise or a bonus, okay, which is fine for many people. I have seen, like, when I work, they're happy with that. When they get that paycheck, they're happy with that. But on the other hand, if you need to have a promotion, you will need to perform well, cultivate a positive image, and proactively gain exposure to a broad area of the right stakeholders. You need to impress. I don't like to use the word impress, express it to the right set of stakeholders when you join the organizations. All right. Now, don't get scared about it, but this is how it has been, how to classify, how to look forward to achieve that pi is what the formula secret, which I would like to reveal to all of you. Okay, the performance is an entry ticket. Okay, it's a reputation builder for you. It helps you to commence with your legacy. Okay, and definitely it's a common denominator in the promotion process. Confirms your ability to take on more responsibilities, must grow to stay above the bar as it is continuously being raised. Remember, we're talking about the competency part of that. So the benchmark, who is creating the benchmark, only that person will be eligible for that promotion, right? And I hope that you are clear with, when I say performance doesn't carry 80%, that's only one aspect of that. Now let's look into the image part of it. Okay, so when it comes to image, this is what other people think about you, your personal brand. Do you maintain a positive attitude always? Do you lead? Are you a person who creates issues? Okay, rather than finding solutions. That is something that people look into. So I normally give an example of this. Suppose, for example, there were 3 people from your team who is presenting in front of the stakeholders. Now, everybody has got an impression about these three people, right? A, B, C. Now, compared to A and C, B is being welcomed with a round of applause. Okay. And everybody is completely glued to his presentation. So it is always there is a comparison which happens. That is because he was able to create an image to other people. He is, an excellent communicator. The body language, the people skills that he has actually acquired is much above compared to the other people. Okay, what do people talk about you when you're not there? Okay, what do people talk about you when you enter? So when you work, whether it is any, when you get into the world of job or career, this is very important to ensure what is the image. Are you an influencer? Okay, can you become a brand for anything? Yeah, will you be called as a brand for anything? Yeah. And for example, certain countries are known for, I remember when we went to Singapore, few people asked us, are you from Modi's country? So you can imagine a country has been known in the person's name, right? And I'm sure that there are a lot of organization who, who's been known with that person's name, right? So likewise, we all are associated with organization, different community. So for example, if we know, if you the one person that you have a great image is a part of a community, you also want to be a part of the community because of that person. You don't know anything about the organization, but because of that person, you're driven towards it. I'm sure that you will agree with me. So it's the message that you sent before you speak, okay, whether intentional or not. It even includes the way you carry yourself, the confidence and the demeanor, right? Develops early in your career, perhaps, if you can. Say, I'm ready for everything. You are the crystal gazer, right? So every interaction counts with that particular person. So that is what we say, that image carries around, uh, you know, it's a good weightage when it comes to your career success. Now, last but not the least, about the exposure. Uh, who knows you? Who all knows you? That's very, very important. How much ever we try to evade away right now, okay, social media is something that we cannot avoid. See, now also we are all sitting here, and many people might have known about this particular program through, because we have got social media or a platform, isn't it so? So does your boss know you? This is very important. What you do to make yourself visible in front of other people. Let me just share a small incident which happened in my own life. Okay. So when I was working for Emirates in Dubai, I remember, like, I was also part of recruitment. So what happened is that when a few people were, the part of the management, and we were all discussing about succession planning and promoting people, okay, for one particular department. And now what happened is that, typically everybody will mention few people's names. So they've shortlisted few people. So in that room, they were trying to put forward a few candidates' name for consideration. Now, for example, one of the stakeholders, me, okay, my first thought process is usually about whether the candidate has got any good, okay. More than that, what I will think, because if he is shortlisted, that means he or she is definitely good, right? Otherwise they will not be actually putting across this candidate's name. They would have crossed many milestones for that matter. So what comes into my mind is that I will think first, okay, do I know him, what they have done um, differently, right? And how have I ever interacted with this person directly? Have I seen him doing any presentation? Have I ever read things that he has written? Okay, have I ever heard other people talking about him? In a nutshell, my dear friends, it's all about visibility. Do you all agree with me? If I don't know that person, this happened, okay? If I don't know that person, I will be inclined to push back, as it seems like, uh, he is not responsible to build up the next generation or the role model if he is not visible. So that is the power of, being, having that exposure. My dear friends, if you're using the social media, use it in such a way that you create that, not only on your performance, you also ensure that you create a good image and your exposure in such a way. For example, if you have a link count, definitely when organization decide to be you, to make you also a part of them, they will certainly look into your LinkedIn account and see, okay, who are you are associated with, what is the how I mean how you have actually portrayed yourself on social media. So this is very important. So I would definitely love to strongly suggest everybody to keep it clean and transparent, and who you are associated do matters, my dear friend. Okay, so that is a high career impact it creates, how other people know about your performance. So your visibility do matter. So people love it, whatever it is we speak, okay, about bad and good thing about social media. Definitely, that's why we call it as followers, right? Because of the exposure. A person has got so much of followers, definitely that person has a lot of exposure. So image with reputation, you become the brand. Okay, it is, image is what you project and others see. Reputation is the impression others have about you. It's developed, it takes a long time. Okay, and the brand is definitely the reflection of the value you bring to the organization. Yes, in fact, if you want a few tips, okay, is like, you need to be confident, you need to be talkative, whether you like it or not. I wouldn't want to say talkative as such, but you need to be very pleasing and approachable, at least a good communicator, I would say. Thoughtful, respectful, determined, a leader, stretching yourself, competent, grounded in. But what we need to avoid is on the other side as well. Okay, you need to really look into. And I would like to conclude here, my dear friends, like, your managers or your bosses or your teachers, they can help you to a little extent create an exposure, but they can't do everything for you. Okay, so it's really something for which that each person need to take that personal accountability. I just want to put a simple question according to you. Who is your favorite teacher and what qualities do they possess? Simple. Why do you like that person? Is it because she only teaches great, or what? Think about a teacher that you really like. What is that best quality that you can reflect upon? Okay, so I love this particular quote: in life you will get only as much as you give, so give more to earn more. One more thing, you can only give what you have. So you need to start acquiring all these, what you need to do to create your image, what you need to do to create your exposure, how to expose yourself in such a way that you create that exposure. Imagine, I'm sure there's a lot of students here. Imagine you want to be a job hunter, or you want others to hunt for you. You want, if you want an entrepreneur, do you want you want to seek the investors, or you want the investors to seek you? You ask yourself. This doesn't happen if you only concentrate on performance. You need to create a great image, that brand, and then the exposure. Otherwise, people will not know you, my dear friends. Whether you want to be a change maker or you want to be a nice person, uh, you need to decide upon that. All right. So thank you so very much for being here. I hope that I managed to keep it on time. I'm not sure about it. All right. So I'm ready for any questions. I hope you have at least started thinking about, about the pile or incorporating that, you can connect with me through my LinkedIn page also, and I put in my mobile number also, in case if you think that I will be of any help to all of you. Thank you so much for giving me this wonderful opportunity. Of course, I'm ready to take questions. If you have any, please do. So I have to really thank Minnie for the opportunity. I call her Minnie Chichi.
Thank you, Raki.
Are there any queries for the speaker?
Sorry.
So I guess there are no queries.
No.
A minute, Amira.
One
Yeah,
second.
sure.
One second.
Vishnu, you have something?
Yeah. Okay. Hello, Ms. Raki. My name is Vijana. Okay. I'm a faculty in TKM. So we have seen that some of the people do a lot of the exposure that you meant. Is it the exposure that the person has on the world, or how exposed are you to the world?
See, that's a very good question. In fact, how you use the social world to connect with them. Okay, how many people know you for that matter? See, for example, if they have to call you as a keynote speaker for something, okay, just an eye. So then definitely, what do you think the judging panel will be thinking? Okay, have you seen his presentation? Have you seen his some pages, or have he spoken in some forum? Isn't it so?
Yeah.
So the moment we say, okay, he has spoken in this particular conference, then we know his credibility, right? Totally his credibility, right? There is no question about it. Correct? Yeah.
Yes.
That is what I mean to say by your exposure.
So, because nowadays we see the bad side of the others, the other side also.
Absolutely. Yeah. No, that's a very good point. We need to be very sensitive. We need to be very sensible and sensitized. But again, it's a little debatable also, as you said. And there are people who doesn't require all these also, right? Okay. But currently, if we are talking to the new generation, we need to tell them how to use it in a nice way so that it helps them to perform very well, to take their career to the next level. That is what I was trying to say.
Okay, thank you very much. It was wonderful. I really enjoyed.
Thank you so much. Yeah.
Mira, just a minute before I conclude. Raki, extremely thankful to you. I can see the passion to the audience. She just came running after her class. I think she joined at 6 o'clock. So we are really thankful. I feel that you are still tired, but still continue till 7:50. That's great. Thank you very much, Raki. We might need your help again also. I'll reach out.
Certainly.
Okay. Thank you, Raki.
Certainly. Thank you so much, Women in Engineering, for IEEE for giving me this wonderful opportunity. Amira, I believe you're also there. Thank you for coordinating with me and then for this wonderful opportunity. Yeah.
Thank you so much for sharing your time and experience with us, ma'am. I think we all agree that your session was the most interesting we have had this year. So we have a very small token of gratitude. I hope you like it.
Wow, it's so beautiful. I loved it. I feel like, I could have got it in my hand, in fact. Thank you so much.
Institute of Technology. Umila, handing on the platform to you.
Hello. Yeah.
Yes, Urmila, you are audible.
Good evening, one and all. First of all, thank you, Rekha ma'am, for the wonderful session. I am sure that all the women engineers who are there are really got inspired of your words, and thank you for your wonderful session, for taking out your time and enlightening us with how to build our image and creating our own passion for a wonderful, successful life. Thank you, ma'am, on behalf of IEEE WiE Women in Engineering Kerala Section. And now I would like to thank Sharada ma'am, IEEE Kerala Section Chair, for being with us and creating such a wonderful opportunity for us. And again, I would like to thank Mini ma'am, Women in Engineering Chair, Kerala Section, for being with us and encouraging us to host such an event like WiE's 2020. Last but not least, I would like to thank all the energetic, wonderful women over here for your patient listening. And thank you. Have a great day.
Thank you, Urmila. WiE's 2020 is designed to provide opportunities to discuss, to debate, to obtain new insights or ideas, to network, and to be an important part of your current and future success. I would like to extend heartfelt gratitude to everyone that have been involved in the organization of this program for their dynamic efforts and all the honorable dignitaries who have graced this occasion with their presence. Thank you all. Thank you all of you here for joining us. Although WiE's 2020 cannot be held physically, we hope that all of you would experience the full-fledged integrity and quality of the content in this virtual environment. Thank you for your support of our shared mission to advance technology for humanity. And with this, we mark the end of the day, for first day of WiE's 2020. Thank you once again.
Thank you.